Brandon.
That's BKS.
I got it. You're here. Cool. Okay, and you're JCCC.
Yes,
All right. Well, I think it is time that we get started. We were expecting Susan Gash and Alex Stevens, but I don't want to make your trip back to Manhattan any later than it usually is. And I appreciate that. Thank you for coming. Oh, do we need to record? Sorry, recording. Yep. Thank you so much for coming, driving from Manhattan. And we do have Blue Valley Caps joining us. So directly at the end, I'll do the chat window and see if we have questions. Okay. So let's give a warm welcome to Dr. Nelson.
All right. Thanks for being here and being online. Okay. Today we're going to talk about internal and external parasites for cats and dogs and things that kind of make you gross in general, those worms and germs. So why do we want to talk about these? Because they have the potential to cause life-threatening disease in our pets. We see it all the time. Some of these are what we call zoonotic, meaning they're usually transferred from pets to people. And so they can also cause serious disease in people as well. And for the companies out there, parasites are big business. There's a lot of money. You guys have probably heard of products like Frontline and Harper being advertised on TV. So there's a lot of money in these parasite products. So what we're going to talk about today is going to be internal parasites. So we're going to look at roundworms and hookworms and whipworms and tapeworms, things called Coccidia and Giardia and Heartworms, oh my. And then some external parasites. A few more of those. We're going to have Flea, Ticks, ear mites, Lice. You're going to find out what cutaneous myitis is in a moment. Sarcoptic mange, demodectic mange, and Chiggers. If you live in Kansas, you know what those are. If you don't live in Kansas, you don't know what those are. Okay, so I'm going to warn you, there are some gross videos that are going to be coming up. So if it makes you nauseous, don't watch, because there are chain reactions of people who start to puke. So I think you know how that goes. Okay, so first we're going to start to talk about roundworms. So roundworms are these long spaghetti-looking worms, and so we have species that can infect both cats and dogs, sometimes only cats, sometimes only dogs. How do they get them? So they can get them from the environment. They get contaminated soil, so for dogs, right? They're out mucking around in soil, so they can ingest it. They can get it by eating earthworms, and I'll bring that point back in a while for those of you who party and eat earthworms on a dinner. Ingestion of vertebrate hosts, so things like mice and rats that are carrying these eggs. So your hunters are going to get infected too. They can also get it from their mother when they're nursing via what's called transmammary transmission, or they can be born with them in utero, so transplacental transmission. So prepatent time, we're going to talk about the prepatent period. That's the time it takes from ingestion of the egg until the adults are formed. So for roundworms, anywhere from 2 to 4 weeks to form an adult from time of ingestion up to 8 to 10 weeks, depending on how they acquired it. So what are our symptoms? So our young animals, our young cats and dogs are most severely affected. These guys come in, we kind of call them a wormy belly. They're bloaty, yet they still kind of look bony and ribby. They often have diarrhea or soft stools going on as well. But they can also have pneumonia, because these worms can migrate through their lungs, failure to thrive, unearthly appearance, and sometimes death, because we can have these guys die from roundworms from impaction in their intestinal tract. It's thought in the general population, so adults and the youngsters combined, about up to 30% prevalence going on. But we do assume that all puppies and kittens have it, a high percentage are infected. And so it's actually recommended that puppies and kittens start being dewormed for this parasite at 2 weeks of age. And then we also know as they get older, there is some age-related resistance. So we have a lot of different treatment options. We have oral medications, especially for the youngsters and adults. And then as they get older, we have some of these topical combination preventives that do several different parasites that we can use as well. And so are they zoonotic? Yes, people can get these. So here's a sample of what people can get. Visceral larval migrans means that these worms can migrate to the organs, and then ocular larval migrans to the eyes. So in people, we can get pneumonia, so these can migrate to the lungs. You can see the worm that's in the eyelid that's up there. And then kids, especially in Southeast United States, this is a fairly prevalent problem for kids down there. These worms in the soil, so where they're in the sandbox playing out there, cats did their business out in the sandbox, kids being kids, don't wash their hands before they eat their food, get infected with this parasite, and they can migrate through the eye and cause blindness. So this is all up. It's prevalent all over, but the further south you go and the warmer and moister that soil stays, the more prevalent we see this. And then in our pets, here's our typically wormy belly puppy. You can see his ribs are kind of showing, he's kind of got that pot belly. He's a typical, you're gonna have worms puppy. And then in the intestinal tract, like I said, these are the long spaghetti looking things. So when people call us and say, I'm seeing worms in my dog's poo, I'm gonna ask them, long and spaghetti-like or short and flat? And I'll show you the short and flat ones later. The egg at the lower left is a type of roundworm egg. It's called Bacillus ascaris. And this is actually a roundworm that's transmitted through raccoon feces, which can also cause very significant disease in people. And so you really don't want to encourage them feeding raccoons, having them up on your deck and things like that. Okay, question. How many eggs can a female roundworm lay in one day? One roundworm, one day. I'm gonna put you on the spot too, Andrew. I brought one of my fourth year students with me today, so you guys can pepper him with questions at the end too. Anybody have a guess?
Thousands.
Okay, 85,000 to 200,000 eggs per day. So that's an actual footage there, that picture of a roundworm, female roundworm that's laying all those eggs. That's a lot of eggs in the soil. That's just one worm. So one thing for veterinarian that we want to do is we want to make sure the puppies and kittens are healthy. We want to deworm them for their health, but we also want to deworm them so all these eggs are getting up in the soil and infecting people as well. Okay, hookworms, moving on, another type of parasite. So dogs and cats, there again, some affect only cats, some dogs, and some species affect both cats and dogs. How do they get them? So there's an infected larva, so the worm, that's in the environment. They can also get it on insects. They're carrying these little larvae around. They're again in a vertebrate host, such as a mice or a rat. They're transmammary, so through nursing again, just like the roundworms. They don't get them in utero though, like roundworms. Or through skin penetration. You'll see some fun pictures here in a moment. Prepatent period, so time when they ingested to time when we're gonna have these worms be adults, 2 to 3 weeks up to 28 days. So these can have a fairly short life cycle as well. So symptom, once again, is the youngsters that are most severely affected. We get infected, we get anemia, bloody stool that's going on, diarrhea, weight loss. They can get dermatitis from the migration through the skin, failure to thrive, unthrifty appearance, kind of like our puppy with the roundworms, and even death, and usually due to anemia with these worms. Of the 36 prevalence in the general, 36% of the general population, it is assumed once again those puppies and kittens have this. And just like the roundworms, it's recommended at 2 weeks of age, we start deworming. So every 2 weeks up to 8 weeks of age, puppies and kittens get dewormed for roundworms and hookworms. Are they, we have the same kind of treatment options we do for roundworms. Are they zoonotic? Yes. So first we're going to show you how this affects our pets. That upper right picture is actual microscopic picture. It's a great one from our parasitologist of an actual hookworm. And they get their name Hookworm from this little teeth-like things that they latch onto the intestinal wall with, and then they suck the blood, little vampires that they are. The bottom is on necropsy, so that's a fancy word for a post-mortem exam, like an autopsy on an animal. You can see all the bloody stool that was inside that intestinal tract. And a few of the worms are actually visible in there as well. So this is why they die from anemia, because they are attached to that lining and they're ingesting all that blood. In people, we get cutaneous larval migrans as well. So a lot of people, this will make you think twice before you go walking the sandy beaches in warm climates. So the hookworm eggs, see there's a lot, not in Florida at the moment, hurricane might wipe them out, but they will be back. So people take their pets to the beach, right? They do their business and then we're walking on the beach. Hookworm eggs are in there, they love that warm, moist soil and that sand, and then they penetrate to the skin, and here's what can happen. The one on the belly, probably they were laying on the soil. On the hand, working in the soil, so you can have these things migrate through. Okay, so another question, how many eggs do hookworms lay a day? More. They're actually less, but thank you for participating. Okay, 25,000 per day. So still a lot, but not near as many as what those roundworms lay. Okay. So next, now we have whipworms. So whipworms are another type of intestinal parasite. They are found predominantly in North America in dogs. They're very common in cats in North America. That's pretty much rare unless you're very, very southern tip of Florida or into there. How are these acquired? They're also by ingesting eggs, usually from larvae that are in the environment. So those eggs are in the environment, and then they're going to get ingested after those larvae after they hatch out. These have a longer pre-patent period, so up to 3 months from time of ingestion until time of infection in that animal. So these guys have what we call large bowel signs. They have diarrhea that has mucus and fresh blood on it, so colitis would be like a fancy word for that. They can get weight loss, dehydration, and for our 4th-year veterinary student, something called pseudo-Addisonian's disease. So Addison's is a really bad disease due to low cortisol levels in the body. So a severe whipworm infection in a dog can mimic that exact same disease. There's a few tests we can do to differentiate. One is a fecal, looking for these eggs, and then there's some other tests we do too. The prevalence of this parasite is a little bit lower, so in general 10 to 14% across the United States. So this is a dog who was severely infected with whipworms. You can see all those other in there. It was not the typical case. It was a very exciting case for Dr. Dryden, who was one of our parasitologists at vet school. We have a lot of treatment options. We have oral medications, topical medications. A lot of them are in our heartworm preventatives, and we're going to talk about heartworms in a moment. Are they zoonotic? Pretty unlikely. There's very rare cases of people getting this. That's one good thing about these worms. But the problem is they're very, even though they cause severe disease in dogs, it's very difficult to sometimes diagnose. Because why? You're going to tell me the answer. How many eggs do they lay per day?
Because naturally going down in
Fears.
numbers.
Yes, because they're difficult to diagnose. So about 2,000 per day, and they shed intermittently. So sometimes what's recommended is you run fecals 3 days in a row to try to detect this parasite. Okay, so we go from 200,000 with roundworms up to only 2,000 per day with your whipworms. All right, tapeworms. The only good thing about tapeworms is they usually don't cause really severe disease, but they are really gross, especially when your pet lays, sits on something, gets up, and they're on your furniture or your carpet. So there are a lot of different species. We're going to talk about a special one called the Echinococcus in a moment. So how do they get them? The ones we see the most around here, they either get them from ingesting fleas, which we have a lot of around right now, or the hunters get them from like mice, rats, rabbits, things like that. Pre-patent period anywhere from a couple of weeks up to a couple of months with this. So they're often pretty asymptomatic with signs, and usually just mild GI, a little vomiting, a little diarrhea here and there. They could be a cause of spooning in dogs. There's some other causes for that. And then occasionally they're really, really infested with these impaction and intestinal impaction. That's going to be rare. So the prevalence, we know from like shelter studies, when they've done post-mortem exams on some of these animals, up to 50 to 60% of just the general population of owned animals, 40 to 50%. But they are hard to detect on routine fecals. And the reason for this one is because the eggs are very heavy. And when we run what's called a fecal flotation, we're taking our sample from the top of that sample. These eggs tend to go to the bottom, so they get missed. So they aren't detected routinely yet. I often have clients calling going, I'm seeing worms in my dog's stool, and most of the time what they describe to me is short and flat. Okay, and so you can see the fresh ones on top of some fresh poo on the bottom side. Up top are the dried up segments. They tend to look like little pieces of rice, or sometimes they'll be shaped like a little cucumber seed. And you'll find them hanging on the hairs around the anal area. Okay, treatment, we've got a lot of options, and then a lot of our heartworm preventers are also including dewormers now and there for tapeworms. Echinococcus only has one specific medication we can use. Are they zoonotic? Uncommon for most species. We'll go back to talk about Echinococcus. So the ones that get through eating fleas, rabbits, and mice, the only way we get those, if we do the same thing. So we accidentally ingest a flea or eat a mouse or a rat that has that parasite in there. So this is actually a tapeworm that someone brought into us that I think it was their cat vomited up. That's a kind of normal size, a little bit longer than this bone. That's the length of that tapeworm. So that's a lot of little segments that are all attached together. Those little ones we saw previously are each one of those little segments that are broken off, but that's one intact. So they can come out pretty long. So it's kind of cool. I love those. Okay, so we're gonna see if we can get this to work. So one day, dog got off our table, and here's what it left us. So we have live tapeworms. So here's our live ones moving around.
Seems
and
like
they're
there's pause,
at
but
the
then it
very
starts
most
picking
they
up
have
again the more she...
stretch out. This was one that started to dry up, so you can see it's getting a little more yellowish looking and a little more condensed Okay. All right, Echinococcus is a special type of tapeworm. It's a bad one. It's most commonly found in people get in people that raise sheep. So it is, fortunately for us, pretty uncommon in North America. But they can get it from direct contact with an infected dog. So they're petting the dog, they get these cysts on their hands, and they go to eat without washing. They can get these or from fecal matter containing the eggs. So what does it cause? It causes these large cysts in the liver, and sometimes even in the brain, so they're called hydatid cysts, and often lead to death that can be hard to surgically remove. And this is a mouse, that's a really big picture. This is courtesy of Dr. Dryden again. But all those little white nodules are affecting that mouse's liver. Again, that's one of the eggs up top. And then even though the nice purplish Echinococcus looks kind of big, they're only like 3 millimeters long. So they're very hard for people to actually see because they're so small. So we do a lot of health certificates for people moving to other countries. A lot of countries have special requirements to get their pets there. Some of these countries require deworming for Echinococcus because they don't want this parasite getting into their country. So there are several places we have to make sure that we use the proper dewormer to get rid of this in the dog. All right, Coccidia. Coccidia is actually a microscopic organism. It's not a worm, it's a little cyst. It affects cats and dogs, and they're host specific. So a Coccidia affects a dog will not affect a cat. They get them from ingestion of cysts in the environment. You can have transport posts like cockroaches and other beetles, things like that. They're hard to get rid of. They're pretty much in the environment. The pre-patent period, anywhere from 4 to 23 days. So what did we get? Mostly these affect the youngsters. It's uncommon to see diarrhea in an older animal from Coccidia, I won't say never, but usually the young animals whose immune systems are still kind of immature, we get weight loss, diarrhea, lack of appetite. They can die from this too. So this can be, for our youngsters, a very bad parasite. So prevalence, we've got kind of a range, 3 to 38%. Treatment, there's a lot of different options. It's zoonotic now. So these are little tiny microscopic cysts that we can only see. This is a little micrometer here, but these are the cysts that are there and there. Okay, Giardia, a lot of you have heard about Giardia. There's a lot of different species. A lot of them are species specific, meaning a dog form will only affect a dog, but some will cross species. How do you get these? You acquire the cyst. There's 2 forms. What you're seeing right now is a troph, that little face, and then there's a cyst, and we'll show you a cyst. The cysts are what are called the infective stage. You can get them from water, ingesting contaminated water, food. They do need a moist environment to live. So people who are going hiking, camping, when they tell you not to drink the water unfiltered, it's one of the reasons why. So a variable pre-patent period, so as early as 3 days up to 10 days. Symptoms, diarrhea, weight loss, dehydration. They can't digest and use their food very well because these organisms infiltrate the lining of the intestinal tract. So we get malabsorption, maldigestion, so you get vomiting, poor viewers. So there's a regional difference. We actually diagnose this quite a bit. We see quite a bit of it. The problem we're having right now is there are treatments, and the one that used to be kind of our standby and worked past few years, we're really starting to see resistance with it, and it's a big problem in pet stores, puppy mills, shelters, things like that, because we do not have a good drug to treat this right now. To the point where if we see these organisms, if we see the cyst, so here's the cyst that's there, and they're asymptomatic, meaning they're not vomiting, there's no diarrhea, it still looks normal, we're actually recommending to not treat these animals at this point in time, which kind of drives me nuts because we know the cysts are contagious and they're shedding them, but we don't have anything else we can really do for them. So general guidelines that are out there, and we'll kind of run through these. We already talked about puppies and kittens deworming starting at 2 weeks of age and going every 2 weeks to 8 weeks of age, mostly for roundworms and hookworms. Cats and dogs, as they get older, should be kept on a monthly broad spectrum deworming product, and a lot of these control heartworms, which we'll touch on here in a moment too. And then fecal recommendations for puppies and kittens is recommend they have at least 4 throughout the year, their first year of life. They have parasites earlier in age, they might even have more fecals then. But as an adult, 1 to 2 a year to monitor and try to take care of these. And then also, we want to try to keep our animals kind of on leash and not just out running where they're scavenging, where they might be eating dead rodent carcasses and things like that. Picking up the feces, and so if you're at the dog park, things like that, promptly picking it up to your pet. cleaning out the litter box or the sandbox if that's happening. And then enforcing leash laws. So if you see people walking their dogs and not picking up the poo, a lot of cities do have leash laws now. And why? Because a lot of these eggs that you just found out can be transmitted to people and infect people. And you've got little kids running in the parks barefooted and things like that. So as a veterinarian, you need to be proactive watching for that. Okay, heartworm. So heartworm is also a worm. It's just not in the intestinal tract of dogs and cats. It lives in the heart. So dogs are the preferred hosts. Cats can get this disease, and we do see it, but dogs are the ones they like to live in. So how do they get these? They're from mosquito bites. So mosquitoes are just becoming more and more notorious for the things they give to us. Pre-pain period, so from the time they're bitten to the time it's an adult is 6 to 7 months. So what do we get? Cough, weight loss, exercise intolerance, to the point where we get what's called cable syndrome, where they impact their caudal vena cava, so we get fluid in the abdomen, we get this big fluid in the abdomen, and liver disease, and so pretty much death of the dog. The areas that are hit the hardest, you can probably guess, further south, so the Mississippi River Valley, things like that, where we have warm temperatures and lots of mosquitoes that are more year-round. I'll show you a prevalence map in a moment. So this is a dog with cable syndrome. So it has an distended belly. That's all fluid that's going to be in that belly. And yet you can kind of see it looks a little ribby and kind of unthrifty. That's a really bad dog with a bad case of heartworm. So treatment, yes. Dog, cat for dogs, yes. We actually had a dog that was in that they thought they were going to have to extract some of these worms out first before they could do medical treatment with chemicals. At the moment, we don't have to, but sometimes they actually have to go in and remove some of these worms because there's so many before we use medicine to do it. Cats, we don't have good treatment options. The best thing is to prevent it for cats. It's expensive to treat, and there's still a possibility of death even with treatment. So we have a lot of choices for prevention. There's pills, there's topical medications for the dogs. There's a 6-month injection. It is recommended you use it year-round, no matter where you use in the state, where you live in the States. We're seeing a lot more heartworm in places where we used to not see it. Why? Because think of what happens when, let's start with Hurricane Katrina. All these animals that got abandoned, where'd they go to? They spread out to the United States. All the rescue groups took them, and they went all over the place, and including Canada. So places that never had heartworm, or maybe some of these other parasites, are now starting to see it more. And then people travel. We take our pets with us. So we got the snowbirds who migrate in the winter and go down south with their pets and then come back. So we're seeing a lot more of these diseases being transmitted. So we do need to test, at least in the dogs, before we start preventive. Because if they are positive, there is a chance to preventives can cause some serious problems for them. Is it zoonotic? No, you're not going to get these right from your pet. But there are some reported cases of people getting heartworms. It's not very many. They get bit by a mosquito, they can get it too. But thankfully, it's random people. But we see enough of it just where we're at in Kansas. So to your left, this is actually, we're looking under the microscope, called a red, you're seeing a red blood cell. So if you've ever looked at red blood cells, you know how tiny they are in the microscope. So that little squiggly thing in the middle, it's an actual what we call microflaria. So it's a baby heartworm. These are adult heartworms. They grow to be about 12 to 18 inches long. So they go from microscopic to 12 to 18 inches long, living in the body of that dog. So you can see why it causes some problems. So this is really cool, you'll like this. So this is a trick we like to do. If we have a heartworm dog that has the baby heartworms, microflaria, we put these in a tube, we spin it down so we separate the red cells from the plasma. And you're gonna see those guys wiggling all over in there. Makes you kind of smart. Let's take a look at our, yes, there's, sorry, sound with those two, I should take that down. All right, so those are microflaria. So it's just kind of a neat little trick. We can kind of compact those down and show students those. So this is the latest incident map from the Heartworm Society. So here you are all out in Kansas City, here we are in Manhattan, and then look, per clinic, here's your caseload of heartworm positives. So you've got the river close by, and then you're getting closer to Missouri, things like that. So you're gonna see more heartworm. Then if you look in this Delta region right into here, heartworms are just awful. So rescue dogs coming up from down there, I guarantee they're gonna have heartworm. They weren't on preventive. Okay, here's a question for you. Anyone know what this is, first of all? I'm looking at this as a cat, as a kitten. That's not my question. I'm looking at it through what's called a woods lamp. So what am I checking for? It's a type of black light. We're checking for ringworm. And this cat's positive, it's glowing, so we're looking for fluorescence, and the little hair shafts will glow kind of green. So my question is ringworm a worm? It's called ringworm, right? You're right, it's a fungal organism. A lot of people think ringworm is a worm. It's actually a fungus. Okay. All right, so we went through some of the grosser internal parasites. Now we're going to go to our external parasites. So fleas, we see a lot of those. And in Kansas this time of year, the fleas just keep mounting and mounting. This is perfect climate right now for fleas. They affect dogs and cats. There's a lot of different species of fleas. Most common flea, oh boy, I don't know if I should put you on the spot, is the cat flea. Okay, I'm not going to put you on the spot. Remember that for boards coming up, Joe. All right, so how do they get it? These things hatch in the environment and then hop on a pet, or they go directly from animal to animal. Pre-painting period from egg to adult depends on the climate, anywhere as short as about 2 weeks up to 50 weeks. So here's what a lot of people find. There's a house or apartment that's laid dormant. Used to have pets in it that had fleas. The people move out, and then a month or two later, new people move in. And what you get is this mass hatching of fleas because they sense that temperature change and the carbon monoxide changes that are in there from the people and the pets moving in. So all of a sudden you just have all these fleas hatching out. Why? Because the time is right. There's something to feed on that came into the house. Okay, symptoms: itching, hair loss, skin infection. Severe infestations lead to anemia and even death. And then they carry other parasites. We just talked about tapeworms. You can get through eating fleas. They're widespread. However, they're going to be uncommon where humidity levels are low. So think of like the arid desert regions, things like that. They're not going to have fleas in through there as long as the humidity levels are stay below 50%. Now, this is kind of harder to tell, but I'll go back to this. This is actually, we took a picture through our phone, through the microscope. This is a female adult flea, and I know they all look small, but she has kind of a bigger, more translucent belly, and then the juveniles are darker and a little more compact. So when we look here, we'll skip those, but here's going to be a female, a little bit bigger, and a little bit of a juvenile. And the reason this is important, a lot of times people will come in and say, I'm using a flea product, but it's not working, I'm still seeing fleas. Well, what I'm going to do is going to go see what stages. Are they adults or are they juveniles? If I'm finding no adults, that means my flea product's working. Nothing's making it to that age. What's happening is they keep having all these hatching out from the environment, hitching a ride, but they're not making it to adulthood. So the product's working, they just have an overwhelming load in their environment. And so just to switch them to another product isn't always going to solve their problem. They have to treat their environment as well. So we have a lot of treatment options. There's topical, there's some new oral products out there that are great. So what you don't want to do is wait until there's a problem that already started, because by the time it started, you've had weeks and months of eggs being laid in the environment. Are they zoonotic? Yes, they will bite you as much as they'll bite your pet. They can transfer cat scratch disease. They can do some forms of typhus. So if you're going to the Four Corners of the United States, there's a type of plague that's down there, bubonic plague. You heard about that? Okay. It's in the States, luckily not here, but it is in those areas. And they get them from the fleas that are feeding like on the prairie dogs and the rodents and things down there. And unfortunately, cats are very susceptible to plague. And then they're out there hunting, catching those, catch their fleas, go back home, and it's potential for them to transmit this disease to their owner or to the veterinarian who's treating the abscess that they have. So they also get rashes and allergic dermatitis. So in your lower left, this is a sheet of paper. So these are just little specks, look like little pieces of dirt when you look at it in real life. It's flea poop, flea feces. And so a lot of people will argue, well, that's just dirt, right? No, dirt usually, a lot of times you get this little kind of curly cute kind of look. That's definitely going to be your flea feces or your flea dirt. But when we add water to it, this is what happens. Now it looks like blood, because what the flea dirt is, it's digested blood, it's gone to the flea, come out the other end. So for owners who we need to convince that their pet actually has fleas, we can brush their pet off onto the table, look for the flea dirt, do our little water trick and go, if there's flea dirt there, you have to have a flea to put it there. So that will usually get their attention. Now, this is a classic pattern for what we call flea allergic dermatitis. Classic is going over the rump, down the tail, and usually the inner thighs. Students don't get to see this as much anymore. When I was out in practice a long time ago, I'm still practice, when I was a young pup out in practice, we didn't have all the good flea products we had. And we saw these walk in the door all the time, itching themselves to death. But you don't see these as much because we do have so many good flea products out there, but it does still exist. Okay, and then the video, our technician loves to get flea eggs off the table, put them under Scotch tape, let them sit for a couple days and wait for them to hatch out. Because why? She likes these things like I do. And so these are actually flea larvae starting to hatch out their eggs under some Scotch tape.
Look at me.
That's cool.
I'm a flea.
Okay.
They can't hoe when they're larvae.
That's what we get now. This is what you can see. Okay. All right. Next, another video. This guy came in last year about this time, was the grandfather of an employee, and the dog was, they were worried because the dog was losing hair and everything. It's a little black Scotty, so he's black, right? Hard to see, but we turned him over, and here's what we found. Lots and lots of fleas, and they were using a flea product on him, but there were lots of other talking and questioning. It just, they had a bad infestation, and the dog was getting bathed a lot, so the product's not gonna work as well. So we just switched him, we did switch him to a different product and really helped him out. Those little guys went pretty fast. Now this is the same dog after we gave him a product called Capstars. So Capstars are a really safe product, and it's a pill we can give them. Within 30 minutes, it starts to kill fleas. And we give it orally. But it's out of their system in about a day. But what it does, it affects the flea's nervous system. And as the fleas, oh, it always says that on this one. It doesn't want to look at it right. Anyway. The fleas will start scrambling all over the dog or the cat and start triggering nuts. We have to warn people about this so they don't think it's an actual reaction to the medication. It's more, all those fleas that are scrambling all over before they die are just driving them nuts. So they'll be shaking and yeah, it's not a fun time for them. I don't know why on your computer always switches this one.
It did before, didn't it?
I know, it doesn't on mine. Okay. So this puppy came in about 3 years ago, and he came in, and he came in as what we call Good Sam. Someone found him, and they brought him in. They handed him to my tech. My poor tech, the fleas were just jumping all over. He was covered, and he was just this little dude, little guy. And I couldn't even make the picture look as white as what he looked. His gums were white. So this guy had severe flea bite anemia. And here's to put it in perspective. So we run what's called a hematocrit or packed cell volume. So we put blood in a little tube, we spin it and separate it. So you have your red blood cells, and the rest of this is the plasma that's in there. So we spun this down on this little guy. This is a normal dog, and their hematocrit's usually around 40%. So here's about a 40% hematocrit. Look at this, guys. He was at 7. It's not even compatible for life. This little puppy was literally dying in our hands when he came in, and we actually got a transfusion into him right when he was literally starting to die. We were watching his heart on the heart monitor. And it was very miraculous watching as we put the blood into him to watch him come back to life. But that's what fleas do when there's a heavy enough load. And you would have been amazed at the hundreds of fleas that came off this little tiny body. Right, ticks. I hate ticks. Okay, so they're the one thing I really don't like. So they pet dogs, cats. There's a lot of different species. It's just so invasive. They're in environments, so not like folklore will tell you, they do not drop out of trees. So ticks live in the tall grass, and they like the more shaded areas. So if you have areas that are shaded, and you have some unknown grass or it's tall, or the shrubbery there, that's where they like to hang out. And what they do is something called questing. So they hang out there, and sometimes they'll be on the very tip of the blade of grass, and they're just waiting for an animal to walk by. And when they walk by, they just hitch a ride. They don't jump. They brush against them, and then they just hitch a ride on there. So it's called questing. So that's where you get them. So through the tall grass, the brush, they're not falling down on you. Pre-pain berries. And I will say there's one species of ticks that actually you're not going to find out in the environment. You're going to find them in the walls of homes and kennels because that's where they like to live. So they're not out in the grass. They're actually in the buildings. And they can be really hard to get out of the buildings. When we get itching, hair loss, skin infection, anemia, something called tick paralysis and death. And then I think you all know ticks can carry a lot of other diseases. And there are regional prevalences where we find some of these species. We find some more in some areas than others. This is a classic, what's called a Lone Star tick. It's called that white dot. We have a lot of those in Kansas. But there again, their territories are expanding. With the Lone Star ticks, turkey and deer, the white-tailed deer, are good hosts for those, and so as they expand, they take them with them. Climates will change it too. So what do we have? We have a lot of options too. We have oral and we have topical medications. Like fleas, don't wait for the problem to start. And really, you can pick up ticks most of the time year round. Starting pretty soon here, you're gonna start seeing those Lone Star ticks, all the babies hatching out, the little nymphs, the little tiny, called sea ticks sometimes. Fall is when they hatch out. So you may be walking through somewhere when you're walking and find yourself covered, or your pet covered with a lot of these little tiny ticks. They just went through a nest of ticks that hatched out. So zoonotic, yes, Rocky Mountain spotted fever, Lyme disease. In the Kansas City area, there's some out in Manhattan. Pretty much we're not Lyme endemic because we don't have the type of tick that spreads it, although they're starting to find the tick. Tularemia, however, can be given to people by ticks and to the animals, and that can be passed back and forth from the animal to the people. Ehrlichiosis and stari. You also have urban disease that's now out there that was diagnosed in Kansas the first time. So you have a lot of bad things that ticks can give you. Okay, ear mites. So ear mites are kind of fun to look at too. So dogs and cats both get those. Other species can, that we're pretty much talking about dogs and cats. Close contact with other animals. They're going to get off the fur of one animal, crawl through the fur of the other animal, make it to the ears. Pre-pain periods are roughly 2 to 3 weeks or so. What does it cause? Head shaking, scratching at the ears. You get this dark discharge in there, scabby. Kittens and cats is most prevalent, and we'll see it in dogs too. If you have a kitten from a barn, you're almost guaranteed it's going to have ear mites. So I'm surprised when we don't find them. In this picture, we have little eggs. And this is the adult. We'll have a better picture of an adult. You can see the eggs are pretty easy to see too on these guys. And so that's some of the dark debris. We can see that's in those ears. We have a lot of treatment, topical medication that we either go on the skin and go systemically, or that we put directly into the ears to kill the ear mites. And a lot of times we have secondary bacterial and yeast infections. We have to treat those as well. Are they zoonotic? Is pretty rare. There's one person, a researcher, who years ago decided to inoculate his ears with ear mites just to see what, crazy I know, just to see what would happen. And his report was, it was very uncomfortable for a week or two, lots of itching pruritus, but the ear mites didn't like to live in the human ear. So they eventually died. So there you go. So people do crazy things.
This wasn't a K-State, was it?
No, I don't think so. I can't remember who did it. And that was done a long time ago. So what we do is we'll take a swab and we'll put mineral oil in the swab to kind of collect the mites, and we'll put them under a slide. So these guys are in mineral oil, so you see kind of swing. I'm sorry for cutting the strobe effect. We're trying to take this through our camera, but they'll be swimming around in there too. And then a lot of times we'll see the eggs. Okay, lice. Lice are species specific, so you won't get lice from your dog or your cat or vice versa. But like with people with lice, it takes close contact with infected animals. And it is not common for veterinarians to see lice unless you're dealing with a hoarding situation or a breeder who has terrible facilities, and there's a lot of illness and just bad surroundings. Pre-pain periods around 3 weeks. They're often asymptomatic. Cats can get some heavy infestations where you get restlessness, ruffled coat. There again, the prevalence is usually young, old, debilitated, poor conditions. I think I've only seen it twice, and I've been a veterinarian for a long time. But there are veterinarians who will see it more frequently there again, who deal with hoarding situations, going to rates, things like that. There's some different types. So there's sucking and chewing lice that are out there, and some respond to some treatments, others to others. Are they zoonotic? No, they're species specific. Okay, cutaneous myitis, otherwise known as maggots. Who doesn't like a good maggot case? Okay, so how do they get them? So female fly, usually it's a blowfly, goes to an area where there's a festering wound or moist hair, things like that, that's spoiled by urine or feces. So there again, a lot of times these are weak, debilitated animals that come in with this. Pre-pain period is as little as 24 hours from laying that egg until the larvae hatch out. So I can almost tell you they're going to have it when they bring them in the door because they have a very distinctive smell to them. You also have visible larvae that are moving there. You may see the eggs attached to the hair, seen that before too. And the pets could be depressed or lethargic or stop eating because a lot of times they have these secondary infections or primary infections that have the maggots in there. So prevalence, obviously we see this more in the summer months when the flies are out, so when it's hot and moist, and usually in animals that are consistently dirty. So Think about an older dog with bad hips, lots of bad arthritis, can't get up. They're laying out in the summer, they may soil themselves, and they don't get to go back in for several hours. Those are the cases we see a lot of times. Or in wounds in like a young puppy or kitten or something like that. So what do we have to do? We have to physically remove them. They're gross too. Sometimes we have to clean up the skin that's around there. The capstar we use for fleas also kills maggots because capstar kills insects. And maggots come from flies, and flies are insects. So that's a good thing. Another neat thing about capstar, even though it's not on its label. So if we ever have a maggot case in, first thing we do is pop on the capstar. And then susceptible animals, you know, if they are weak and debilitated, you need to keep them indoors, try to keep the flies away and monitor. Are they zoonotic? No, but talk to any ER doctor and they'll talk to you about the maggot cases they see coming with people. Kind of gross, okay? So you're gonna love this video. It's a good one. This came in last summer. And this isn't even part of it. This dog had a pile of them in the cage she was in. This was an older dog. She had severe arthritis. The owner was gone. Someone else was taking care of it. Thought it would be nice to let her go lay out in the sun one day. And because it was a nice sunny day. And then they came in, and what you don't see are all the wounds on her. But she had a severe case of maggots. And nothing was intentionally cruelly done. They just didn't know, but that's what happened. Okay, does anyone know what this is? I might ask you that one, Andrew, but I'm going to give these guys a chance first. These are fun. Andrew?
It's a fly. It's a fly larva.
It is a fly larva, so it's called Chiggers. Yeah, he knew they were from flies. Okay, so we do see these, and I love them when they come in. They're hit and miss. We get maybe one or two a year. So where do they come from? Like you said, from a fly. So this is another type of fly maggot, but these are bigger. These come from a botfly. So how do they? And so this is a real case, little kitten that came in. So dogs and cats are accidental hosts. They like to live around rabbit burrows, is where these are a lot. And so, so these maggots hatch out. And if you got a cat or kitten, it seems like we see more in cats than we do in dogs. Sometimes what they do is they actually inhale these, and then they go through, and then they go to other parts of the body. But they can lodge like in the spinal cord, the brain. So we don't always just see a skin lesion on these guys. So these guys will come in looking like an abscess, so a big filled cavity, but there's a difference. There's an opening, there's a hole. And when you look, you'll see them moving in there. But they're also saying they're infected. Pre-pain period is usually 3 to 6 weeks. So they're pretty distinctive. And I can't even get this blown up enough. They have these little spine-like things on them. So usually they have that pretty distinctive skin lesion, but you can have neurologic and respiratory signs too. So like the maggots, we're going to see these in the summer months when the flies are around. You have to remove these, but you have to be really careful. If you accidentally crush them while they're still in the skin when you're trying to remove them, the animal can have an anaphylactic reaction to it. So we have to be really, really careful when we take these out. So historically, ivermectin was recommended, but as I found out one summer, because we had to delay the removal on a really busy day, the kitten had fleas too, so I gave it capstar later that day. When we went to remove the Chiggers was dead from the capstar. Makes sense, came from a fly, right? But we still have to pluck those little guys out. So are they zoonotic? No, not directly from your pet. There are some cases of humans having this too. They're again pretty rare. Okay, sarcoptic mange. Primarily we see it in dogs, rarely in cats, and they get it from pretty much close contact, direct contact, or from a fomite. So a fomite is something like a brush that you brush one dog with, and then you go brush the other dog. So it's transferring that. Pre-pain period is about 3 weeks. We get thickened skin. These guys are itchy. If I ask the owner on a scale of 1 to 10 how itchy they are, they're usually anywhere from 8 to 10. And they'll be in the office. They'll be stopping and scratching the whole time. So a lot of times their skin's very thick. They're self-mutilating themselves. It's relatively common. So these are the eggs down here, and then this is an actual one we found on a case that we had. So there's only 2 things actually approved to treat it. Some of the newer flea and tick products are showing efficacy against it too. Our dermatologists actually had this case in, so we took some pictures of this. This dog had very thickened skin. And so these guys, kind of the classic lesions are ear margins. And if they actually scratch the ear margins, they tend to kick their hind foot. About 80% of the cases will do that. They'll have some lesions around their eyes, their elbows, and their lower back legs on the outside. Now, so it's a pretty common presentation, but dogs with severe allergies can also kind of have that same pattern too. So is it zoonotic? Yes, people can get this from their dog, but the mite doesn't like to live in people, so it'll make you transiently itchy, but it can't complete its life cycle on you. So eventually if they die, it's gonna wait, but until your dog is treated, the people around it are gonna continue to get kind of these itchy come and go lesions, usually on their forearms or their chest where they're hugging and petting their dog. Okay, demodectic mange is a different type of mange. Dogs and cats can both get it. They have their own species each. And also people have their own form of this. It tends to live in your eyelashes, by the way. So there's long body, what's called long body demodex, and that's an example of one on top, that both dogs and cats have their own species of. And then one specifically for cats called short body, they have fancy names. The long body demodex take direct skin-to-skin contact with the mother when they're young. It's usually considered not a contagious type of mite, but they do get it from their mom when they're nursing. But as they're older, it's typically not considered contagious. Repairing period is 20 to 35 days. Your short body demodex, and I'll show you a picture of that, which is what we find in cats, is what's located more superficially. That long body likes to live in hair follicles. Your short body's more superficial on the skin. That is definitely contagious from cat to cat. So we have a little bit of difference there. So in dogs, we get patchy hair loss, itching, sometimes itching. A lot of times they're not infected, and then red skin. And in cats, we can just get hair loss and that's it. So a lot of people think maybe the cats are just psychogenic, like they move and just kind of go nuts, so they're stressed out, they're just over grooming. Or a lot of these guys may actually have the short body demodex. So in dogs, long body's common, especially in young immunocompromised. So we see a lot in puppies. If we see it in an older dog, what we have to do is look for something else going on, because if an older dog has symptoms of demodectic mange, there's something suppressing their immune system. So some other disease is going on. Cats, the long form's unbodied. The short's rare, but we still see it. So for right now, the only treatment option for dogs that's approved, what we call approved or labeled, is a series of dips. But we have a lot of these medications that are off-label that will work for it, and usually we choose those because it's way better than doing a stinky dip. Cats, we don't have any label treatments for any of them. The short body usually dips. There's a new product on the market for cats that the parasitologists feel may be working, which will be nice, because historically this is a hard one to get rid of in cats. And are they zoonotic? No. So this is a young bulldog. And so a lot of times they call this red mange. Why? Because it gives that really red appearance to the skin. And sometimes it will only form around the eye, and we won't see any other lesions, but most of the time we see other lesions on the body. And so these are long body, you see their long tails. Now the cat, sometimes all we get is this over grooming. You can see the short body has a little bit shorter, kind of a club, stubbier tail. It's a little bit different appearance to those. And this was not the cat we saw, but these are the mites we took off of the cat that we saw. So here's some long body. It likes to be along the hair follicles. So here's one, we just actually plucked the hair out, put it under the microscope, and here's the demodex laying along the hair shaft. There's another little one starting to kind of rise up there. But this is kind of a cool one because it's laying right along that hair follicle. And then this was short body demodex we took off of the cat. And it was actually, oh, no, you're not gonna work? Okay, I promise it moves. So anyway, usually we don't see it moving, but this one was kind of slowly moving around, so it was kind of cool. It can be really hard to find these short body demodex on cats because they groom themselves so well that they remove them from the body, and so it's hard for us to find them. So a lot of times actually on fecal samples, we can find these mites because they go and digest it and they just kind of go out the other end. So that's a way to diagnose that, and that's the way we get our diagnosis in some of these cats. All right, chiggers. Chiggers are in dogs and cats. How acquired? Going through the grass, the low-lying vegetation. They need higher humidity levels. So, you know, summer's when we see these a lot too. There's your pre-patent period. So when you get red bumps on the skin, some dogs, a lot of times we see these between the toes and their armpits and their belly where they're hairless there. And we primarily see them in the dogs, so that we do see them in cats on occasion. So it's regional. Not all parts of the countries have this. We have vet students who have never seen chiggers, and then they come to the vet school in Kansas, they find out what they are. So summer and fall is usually when we see them. So there's a lot of flea and tick products will kill them, but the whole thing is you want to try to repel them so you don't get bit to begin with. And they are equal opportunity feeders. So you can see that's a leg of a guy, that's a belly of a cat. So this cat belonged to a vet student, and it came in because it's really itchy, and we actually found chiggers in all those lesions. So that is not a common occurrence, but it's kind of cool. I mean, it looks a lot like a guy's leg there. So there again, for these external parasites, we have topical and oral medications. Some kill and repel, depending on the product. Sometimes we have to do premise treatments, like when you have a lot of fleas in the house or ticks that are infesting, or chiggers in the yard. You have to, for us, we a lot of times have to treat the secondary infections because it's not only the parasite, but with the damage they do from the itching, now we have bacterial infections that we have to treat as well. We want to try to keep them away from sources of infection. So we talked about like with maggots, keeping weak, sick, debilitated animals inside. Same would go for fleas. You may need to do what we call a hygienic clip around the anal area. If you have animals that are prone to getting fecal matter stuck there, or some of these older dogs leak urine, and so we need to keep that groomed up. And there again, a lot of these new flea and tick products have just come on the market past couple of years. They're showing efficacy against a lot of these external parasites, even though they're not labeled to do those. And so, as a veterinarian, having flea and tick control and external and internal parasite control is a very important part of our job. We talk about this over and over, pretty much every appointment. We were talking about either heartworms or fleas or ticks. It's a big part of our job. There are a lot of options on the market as far as for treatment and for preventives, but they're not all created equally. This case was a few years ago. 3 dogs, same family, had the same flea and tick product applied to them. Didn't go so well for those dogs. They had contact reactions to them. So not all products are the same. So you do want to discuss your options with your veterinarian, or when you're a veterinarian, you're going to discuss options with your clients. And then, because they're going to be most familiar with their pet, they're going to know the other concurrent diseases that maybe should be reason why they shouldn't be on some of these products, because some of these products are not to be used if dogs have had histories of seizures, or if they're on other medications. And then so they can help you pick the most appropriate product. So now, when we're about on time, a little over, don't eat earthworms. Why? You might get roundworms, right? So don't do it. And then, or eat fleas, and then go eat some rice or spaghetti tonight, okay? Just think about this, okay? Do you have any questions at all? And if you don't have them for me, you can pepper my 4th year student with questions. Who just got back from Africa on Saturday on a really cool trip, by the way. Anybody?
So for the,
Okay, we have questions.
No.
All right.
You talked about the secondary infections could be bacterial infections. Is there a similar a case happening in animals when compared to humans in terms of like antibiotic resistance from
Yeah, there are some where we do see some of that resistance. Yeah. Fortunately, it's not a lot, but we do see some. And so some of these where we get recurrent infections that just don't seem to be responding, and we think we have the primary cause under control, we do culture and we check for them that those still resistant infections.
so for the Demodex mange, if you see the cat like over grooming and you can't find any like actually like on the skin or in the hair or anything, do you pretty much instantly just be like, oh, we should probably get a fecal, or what do you do if you?
Right, you should run a fecal. So dermatology workup for a cat should include a fecal sample because we're looking for that.
Gotcha.
Otherwise, like how we got that sample, we just took Scotch tape. Well, we did it 1 or 2 ways. We did Scotch tape and just pressed it on the fur to try to pick up some of those mites. And sometimes I'll actually put mineral oil on a blade and just kind of like comb the cat's fur, so the mineral oil will pick up some of those mites as well. Any other questions? Do we have any online ones?
One from Blue Valley. Okay, so we kept the little guy on bar. So I checked. All right. Do the worms lay eggs every day of their adult life stage?
So that's a good question. So with like roundworms and hookworms, yeah, pretty much. When we talk about the whipworms, they are intermittent shedders, so they don't lay them every day. So it kind of depends on the worm. It's a good question.
What's been the most unusual case you've ever seen of a parasitic infection that was completely out of the blue?
Oh boy. Oh wow, you're catching me off guard. I'll tell you one I heard about. I haven't seen it, and it'd be so cool. So This is from some other primary care practitioners that are down in Georgia at their school. So when their vet students were doing spays, doing a spay on a dog, they have to ligate some arteries, so they have to cut some arteries. There was a heartworm in the artery of the spay site that was moving. So that would have been so cool. So those are neat. There's a type of tick, which I didn't have a picture of, and I've only seen it once because we don't have them in Kansas, called a spinous ear tick, and they're kind of a plump, fat tick. To me, it's like a raisin with legs on it. They're a little bit different type of tick, and so the animal I saw it in was a working cow dog. The guy was on the rodeo circuit, had come from Colorado, and so the dog had him, and I come in, and so when I looked in the ear, I'm like, those don't look like regular ear mites in those ears, and so it was a spinous ear tick, kind of cool. Not as great as the Heartworm though. So yeah, we see them all over. The dog we have right now with Heartworm disease that's up at the clinic, she's pretty severely infected. It was a rescue dog, little dog who's been having some complications. She actually had one of those worms die, and they basically throw a clot to the lungs. It's just dead worm instead of a blood clot. And actually came in respiratory distress because of that. So. Other questions?
So in Africa, did you see any interesting parasitic cases?
We saw some, what was it? Saw some aspirin infections in a group of captive lions.
So aspergillus roundworms.
So yeah, so kind of like what we talked about earlier. Now we saw some of those. All the tigers in general will have echinococcus. So if you're ever handling a tiger for whatever reason, always wash your hands afterwards.
So that's when we talked about causes of cysts in the liver, things like that. They're bad.
Yeah, those are bad. And then one of the last times I was there, not this last time, but everything on the property ended up with a type of Coccidia. So Nymeria is the ruminant version of Coccidia. And so everything on the property had it. All of our ruminant species, it was just all over the place.
Do you guys know what a ruminant species is?
So cattle, goats, sheep, anything like that. So it infected our giraffe, it infected our wildebeest, it infected our impala. All of those things ended up with, it's all over the farm. So we had to go and treat the feed sites that they were on and then clean those up and try to depopulate a little bit so that we could get that back under control.
So a little bit of herd health there with them. Do you see any maggots?
Yeah.
So
There was it was gross. So we had to go and take an impala for a necropsy day we have student groups that come in. And one of the days we have a big pathologist come down from the University of Pretoria, and so we have to provide him with a specimen for the student's necropsy. The person attempting to take the impala missed and took off jaw, and we got a hold of that impala 2 weeks later because it had gone and hidden in the bushes and miraculously survived for 2 weeks. It was terrible when we got it. It was just maggots pouring out of the jawbones. And then we had a zebra we have no idea what it did. It could have been caught in a snare at some point, but it looked more like something had gone through and through its pastern joint. When we got to it, there's just a big open wound full of maggots. We sprayed it with something called F10 wound spray, and all the maggots started pouring out of it. It was gross.
I think the story reminded me, you asked me one of the grossest ones. So years ago, we did have a cat come in, and one of his eyes was missing. The whole sock was full of maggots, and they were swirling around, and his face was half gone. That cat survived, but that was a pretty gruesome one. We could talk all sorts of, and we all eat dinner while we talk about these, by the way. That's a veterinarian. We have to really eat dinner and tell these stories at the same time.
It's the best time to tell these stories.
Yeah, it
Then you
is.
get seconds and everyone else is
There you go.
So are you seeing more cases of resistant cases to anti-parasiticides? Are you seeing?
Yeah, with the fleas, we're like frontline with fipronil, just a straight fipronil. There are some areas where we're starting to see more resistance with that. In the small animal side with hookworms, a little bit, and we talk about Giardia, but the cats and dogs definitely being a problem. Large animal side, we know with horses and cattle, we have resistance to some of the traditional dewormers that used to be out there. And our heartworm preventives. And then, not so much here, but in that Mississippi Delta area, there's a couple of pockets where the heartworm preventives we have right now just don't work. There's some resistance. Luckily, that's only a few small areas, but it is around.
So are companies trying to bring out new products so to kind of combat that issue, or?
As much as they can. From what I've been told, to get some of the new products, some other countries have products we don't have here. Like for heartworm disease, before the FDA will approve them over here, they have to be deemed 100% effective. Even the products we have aren't 100%. So actually working on legislation to get that changed. Because right now what we have like for heartworm control, they're all in the same class of drug. We don't have any other different class. So you have some of those barriers you have to hit against. And I know for safety they're needed, but they can be frustrating too.
I'm going to put in a plug for varied careers in veterinary medicine. I mean, consider research because those cutting edge products need to be developed.
Well, and we are in the health corridor here, and so there's some companies, not so much, some of the clean tech products are out there too. So some of the new ones that just came out within the past few years are very cutting edge, and just non-parasite products alone. There's some companies in the Kansas City area producing some very novel new products too.
Any other questions from Blue Valley Caps? Looks like they've already tuned. They
got tired of the maggot stories.
But thank you, Dr. Nelson.
Thank you, guys. This was wonderful.
Okay.
They're still around.
Master.